and for keeping in touch with our programs and entertainment. My name is Barasa Saenyi Nicholas. Welcome to Health, Hygiene and Wellness. Today in our program we have Dr. Silas Wambulwa. We are going to discuss more about cancer. Since if you are not aware, February is a Cancer Awareness Month. So in the consecutive episodes we'll be discussing about different cancers, but today we are generally discussing about cancer. So welcome, Daktari, in this episode.
Thank you so much.
How is your day?
The day is good. Thank God we are healthy. Yeah, glad to be here.
Welcome again to another episode.
Thank you.
Now, if I may just begin by some statistics from the National Cancer Summit that is ongoing at Nairobi. We're having 46% of cancer cases which are at an advanced stage. The National Cancer Report is at breast cancer is at 15.9%, cervical cancer at 13.3%, esophagus cancer at 11.8%. That is nationally. Then the cases among women, we have breast cancer at 26.5%, cervical cancer 23.2%. We're having esophagus cancer among women, that is 8.8%, and cases among men, we have prostate cancer at 23.7%, esophagus cancer at 15.9%, and colorectal cancer, I think that is cancer for the colon, is at 8.8% for men. Yeah, that is it. That's some of the statistics that we found from the summit yesterday that is ongoing in Nairobi. Now, if we just begin, Daktari.
Yes.
Why is it hard to treat cancer?
Yeah, it's a good question. Why is it hard to treat cancer? It's because from the statistics you've just gone through, you see those numbers are high.
Yes.
And the reason why they are high is because they are coming at end stage. And that is also another reason why it is difficult for us to treat cancer, because most of the people, even those who are listening today, they come to us when it's too late, when we can't do anything. But in our discussion today, you realize that it is also easy to treat cancer, very easy. So people have stereotyped that it's difficult to treat cancer, but us as doctors, we have my colleagues who are oncologists, they believe it is easy to treat cancer. Other countries have advanced, they are treating cancer. We have so many cancer survivors. Even here in Kenya, we have so many cancer survivors. So it is not that difficult, only that people will have reasons as to why people can't access cancer care. And also in our country, Kenya, also access to cancer care is a problem. The drugs are expensive, the chemo is expensive, radio is expensive, so that makes it complex. Then also the turnaround time for cancer treatment, like for example, if you are to go to KNH today for cancer treatment, you expect that you'll be treated today. But again, because of the long queues, you'll be told to come back after 3 months. That's what we are discussing in the Cancer Summit that's ongoing in Nairobi at Safari Park Hotel. Yeah. And
can cancer be cured?
Yes, you know, there are different types of cancers, just like we discussed earlier on cervical cancer, breast cancer. The cancers that you see that are leading on the list, they are much curable, for your information, more than the cancers that are not on that list.
I can see lung cancer is not even on the list.
Yes, and you realize that lung cancer is even more serious than breast cancer. It's not easier to treat lung cancer than breast cancer. So the cancers you are seeing leading on the list, they can be treated. They are treatable. Only that our people are coming to us when it's too late. But they are leading on the list because somebody has a breast cancer, they are treating it as an abscess for a very long time. By the time they come to us, it has already moved to the lung, it has already moved to the bones, so you can't really manage it. So it is easier, it's curable. To me, I have as an ambassador of non-communicable disease, I always say it's curable. Nothing is impossible. That's why you go to school. We can't go to school so that we can just let our people to die. But the cancers are curable at early stages. So we have to enlighten our people to come to us when it is at early stage. Yeah.
Apart from breast cancer, cervical cancer, esophagus cancer, colorectal, prostate,
Yes.
what other types of cancer do we have?
There are so many, Nicholas. There are so many cancers because any part of your body can get cancer apart from the hair alone. Yes. It's only the hair that can't get cancer. Your nose, your eyes, your gums, your jaws, everything can actually get cancer because they have cells. Anything that is in your body that has cells can easily get cancer. Cancer is a disease of the cells. It's just an abnormal multiplication of the cells, which is not normal. You know, the body restricts some cells to multiply, or maybe to maintain a certain shape. But when you have cancer, there are two things. The cells are multiplying abnormally, or maybe they are changing shape into a different shape that leads to cancer. And you know, when they change the shape, normally there are those changes. The body loses its normal structure. There is a growth. There is an abnormal growth which needs more blood. That's why you see these people having anemia and other things. So any cell in your body can easily get cancer. There's no cell in the body that cannot get cancer. But there are other cells that are more at risk of cancer, especially these cells that keep changing. For example, the breast. You know, the breast of a woman keeps on changing every time. Today it is big, tomorrow it's small.
The cells mutate.
The cells, they are not mutating. That's normally normal physiology. For example, when a woman is pregnant, the breast will be bigger than when a woman is not pregnant. So when the woman is ovulating, the size of the breast is different from a woman who is not ovulating. So it is affected by certain hormones. So just by that nature of changing the hormonal shifts, one can get a risk of developing cancer. Then there are other things. There are cancer cells in your body. There are people who are at risk of cancer genetically, just by virtue of being born in a family that has somebody who has cancer. Maybe even you yourself, because some people usually ask, our family does not have cancer. Why is it that I have cancer? It's because the cancer that you have is just coming because of genetic mutations in your body, your own body. You don't have to blame anybody. It's just an abnormal occurrence which you could not have wished to occur, but it has occurred, that you are getting cancer.
What increases the risk of getting cancer?
The risk of cancer, you know, you've seen what has happened, and I even have some statistics here, which you can allow me to go through. In the year 2020, I think that's when we had COVID. All the screens were talking about COVID. But do you know what? We lost 10 million people because of cancer.
1 million.
Globally. 10 million. Did you ever hear that?
No.
But you only heard about was it how many people who lost life because of COVID? It was almost. Did it go to 10 million? I guess maybe around 10 million. So they were only talking about COVID. But again, we lost 10 million people because of COVID, because of cancer. So cancer, people are losing life globally. This is worldwide. Yearly. This is for a year, 10 million. So you can imagine the numbers are high. Look at Kenya now. Kenya is actually the second leading cause of non-communicable diseases. So cancer is so rampant in Kenya. We are after cardiovascular disease, this stroke, heart attacks. The next cause of death is cancer. If you go to any funeral today, if somebody has not died of blood pressure, diabetes, they have died of cancer, especially the adults. So you can see the magnitude of this problem. Then it's also the third leading cause of death, as I've said, and also there's been an increase of 16%. That's the point I wanted to do. From
2020,
from 2018 to from 2012 to 2018, actually there was a sharp increase of 16%. That's why you are giving these statistics.
Yes.
I'm yet to look at the Kenya Demographic Health Survey statistics, but I guess this is what they picked from.
Yes.
Probably, which was released recently, probably these numbers might be higher. So we are losing people because of cancer. And you know, if you look at also Kenya, I remember during the economies of Kibaki, you understand?
Yes, yes.
Yeah. There was a paradigm shift of actually urbanization in the country. There were roads, you know, those rural areas that didn't have roads, they had roads. Kibaki did something that helped Kenyans. He brought down the price of motorbikes. You remember that?
Yes.
So when the price
that is how they were introduced.
Yeah, when the price of motorbikes came down, everybody was owning a motorbike. Initially, we could use bicycles.
Yes.
So you could cycle yourself.
Yes.
So that was enough exercise. But now motorbikes came. So we were using motorbikes. You see, that has brought a great impact in our nation because our people in the villages are not working. So if you go today, the people who are losing life more are in the rural areas. Even the theme for this year's cancer, World Cancer Day, that is we are observing tomorrow on 4th.
Yes.
Actually, you will realize that the reason why we are having many cancers is because the people in the rural setups are getting cancer, but they don't know. They are still having other things. They think they are maybe superstitions, maybe it's witchcraft.
Yes.
You know,
a lot of myths.
There are a lot of myths and misconceptions which are not true. So that's why people are having cancer and they are not being diagnosed well. So we just have to really make sure that we bring people. So the risk factors is lifestyle, basically.
Lifestyle.
Yeah, it's the leading. So exercise, lack of exercise is one. Another thing is diet control. Their food, I know there's been a discussion about GMO, but GMO has to be left out. That bread you are eating every day, that blueband you are applying on your bread every day, that soda you are drinking every day, it's not bad. But if taken in excess, it has some risk for cancer. And you are eating starch, you don't do exercise, there is a great risk for cancer. So those are the things. And also smoking. You've seen the trends. I heard that Kenya is number 3 in East Africa in terms of using, is it bang or what?
Number 3.
Information. Yes. So, you know, people are smoking.
Yes.
And whenever you smoke, the cigarette smoke, especially tobacco use, not even just smoking. This one, you can apply kwa mapua. You know it, there's a form of tobacco where people use
the old men use
the old men have used it so much. It's one of the leading causes of esophageal cancer. Yeah. So those are the things that people are doing. Alcoholism. People are taking alcohol in Kenya like no man's business. So they are the causes of, that's why we saw colorectal cancer in men is coming number 4. Why? Because of their lifestyle. There is nyama choma. Nyama choma always has caused cancer in the ancient days. So it is still there. So those are the problems that we have.
So those are the risk factors.
Yes.
And what is how do all cancers begin?
A good question. Cancers begin in a very nice way. They are not very rampant in the early stages. There is always a precancerous lesion first. Before you get a cancer, there is a precancerous lesion in your body waiting for a trigger. So when you get that trigger, that is the one that makes you now to develop cancer. So that's why in the first stages of cancer, precancerous, you can't pick it, you can't see any lesions. For example, cervical cancer. If somebody has cervical cancer, they don't have cervical cancer that year. It started 5 years ago. So there were precancerous lesion in that cervix, which could have been chopped off or maybe treated or maybe done cryotherapy. Then you
prevent the cells.
Yes. But people leave it until it becomes cancer. So when it becomes cancer, again this cancer grows very slowly. You can stay in stage 1 for almost a year, 2 years. After 2 years, you now go to cancer now. When you get to cancer, it depends with your immune system, with everything in your body. So whenever this cancer increases, you realize that you are moving stage 1, stage 2, stage 3, stage 4. So that's why we tell our people the only best way to understand if you have cancer is to screen. Just come to the hospital for screening. Screening means you don't have any single symptom, but you are coming for cancer checkup. Yeah. So that's where we get the trick about cancer. Yeah.
Now, can cancer be passed genetically from maybe father to child?
Yes, we've seen some types of cancer that can be passed. As I said, in the risk factors, there is genetic predisposition. So like if there are families that have breast cancer, you know, and there are cancers that move together, like bone cancer, we have cancer of the prostate. They can be passed from generation to generation.
Even prostate?
Yeah, even prostate.
Wow.
Yeah, there is a risk for genetic predisposition in prostate. Actually, all cancers, even this cervical cancer, there is always a risk for genetic especially gene mutations. If your parent has a gene mutation and you tend to get exposed to that mutant gene, it can be moved to a second generation or a third generation. So these genes, they always stay in our body. They mutated, but they are still there. So it moves from a parent to maybe a grandchild or somebody else. Yeah. So you realize that there was a mzee who had cancer years back, then a grandchild. When they get old, also they are having cancer. Yeah.
Wow.
Yeah.
And someone asks, why do healthy people, someone looks just healthy but they have cancer?
Yes.
Why is it so?
It's because, as I've said, cancer is, I always call it, is a sweet disease. It does not give you symptoms. It doesn't. So you're just sick. There's a growth in your maybe I've seen even women who come to us, they feel they are pregnant, but it's now over 9 months, they are not giving birth. It's 2 years, they are not giving birth. When you go and check, you realize they have cancer. So it does not have symptoms. That's why you see healthy people losing their lives, because by the time now you realize it's cancer stage 4, that's when it becomes rampant, because cancer stage 4 has moved to so many organs. It has moved to the heart, to the kidneys, so your body cannot sustain it. So once the body refuses to sustain the magnitude of cancer, now you develop the symptoms. So that's why people are just healthy, because it's a disease that does not give you symptoms. Actually all non-communicable diseases, including, did you know that people who smoke are sick? Do you know that?
How are they sick?
They are already sick because their lungs are not good. But they always just come, they are part of us, but they are sick, you see? Because the moment you start smoking one cigarette, you are already sick. So the moment you continue taking those cigarettes every day, you are worsening the sickness. But you don't feel it in your body. One day it will just come as cancer, lung cancer, it will come as cardiovascular disease, and maybe you can lose your life. So there are some sicknesses, these are uncommunicable diseases, they don't give you symptoms. Even diabetes, people don't have symptoms. That's why we encourage people to come for screening, so that we can prevent and reduce the burden of cancer. Yeah.
Now, as you say, the cancer is a sweet disease because it doesn't give you any signs or symptoms.
Yes.
How does one feel when they have cancer?
Now, when you have cancer,
maybe at different stages,
that means already cancer has set in. Let me use an example of cervical cancer, which is killing more women, and even breast. Let me use an example of breast cancer, because the breast is the most obvious organ in a woman, which we are not supposed to miss if it has cancer, isn't it?
Yes.
Are we supposed to miss the breast when it has cancer?
No.
We are supposed to see it early. So this woman will have a breast lump. So this breast lump is not painful at all. Then after some time, they just realize that, oh, there's a lump, there's a ball in my breast that always keeps moving. Today I feel it, tomorrow I don't feel it. They don't care about it. So one day it develops pain. Another day it starts oozing pus. That's when a woman comes to the hospital. By the time we check that it's oozing pus, already it has broken the capsule. You know, there's that thing that capsulates the cancer cells.
Yes.
So whenever it breaks, the cancer spreads to other other parts of the body. So by the time we check, it has some parts deep inside, it has moved to the bones. There is nothing we'll do. We just do chemotherapy, radiotherapy, maybe remove part of the breast, then we get the woman going. But the risk of reoccurrence is higher than if this woman came to us when there was a breast lump. Just a breast lump in the breast. If you came to us, we remove it, we've moved all the cancer cells from your body. Yeah, then we continue screening that you don't develop the cancer again. So for these people who have symptoms, there are always those obvious symptoms of cancer. Lethargy, just being tired every time. Whenever you want to do something, you get tired easily. At times when you go to sleep, you don't sleep well, you keep turning in your bed. Those are the signs of cancer. They look like malaria. There is a fever, there are chills, you get anemic, you lose blood, you get anemic, you start also losing blood, you know.
Yes.
You have those symptoms of cancer. Then there is wasting of the body, weight loss. When somebody has weight loss, you know, people usually celebrate weight loss at times because maybe you've been big,
you've been obese for some time.
Yeah, you are not supposed to unintentional loss of weight. You know, if you have had this weight for many years, then you start realizing you are losing weight and you have not done anything. You are not going to the gym, you are not doing exercise. That is a sign of cancer. I'm not saying it's cancer, but it could be a sign of cancer.
Yes, yes.
Where especially more than 10% weight loss. So that means you could be having cancer. Then there's also obvious swelling. Maybe if it's a breast cancer, there is a swelling of the breast. If it's a cancer of the jaw or maybe colorectal, there is swelling of the abdomen. So probably those are the signs of cancer that we'll have. Then there is bleeding. Sometimes, for example, colorectal cancer,
yes,
a patient might be having bleeding when they are passing stool. Whenever they go to the toilet, there is blood that remains on the tissue paper. So that those bleeding, it means there is maybe a cancer, a growth inside the colon,
yes,
that is causing the bleeding. Or maybe any kind of bleeding that is not explained. It could be cancer. Even those bleeding, even just bleeding from the gums.
Yes.
Sometimes it could be cancer. So those are the things that you need to observe when somebody has cancer. Yeah.
Now, Dr. before we take a short break,
yes,
can one permanently heal from survive from cancer?
Yes. I started by saying we have champions of cancer. We have survivors of cancer. Very many.
They've been healed permanently.
Yes. Especially those who came to us in early stage. You know, people fear that I've heard this myth and misconception in the community that whenever they tell you have cancer, that's the beginning of your death. I don't know if you've heard that.
Yes,
people usually say that. Even in the hospital, whenever we realize there is cancer, the relatives will start telling us, you know, don't tell him it's cancer. You know, atashtuka. You hear that?
Yes.
Yeah. So people don't want to hear it's cancer, but acceptance is first step of healing. Because when you accept, it will open me up as a doctor to tell you that this is first stage cancer. But now, how will I tell you that it's first stage cancer and you don't even want to hear about cancer? So the moment I tell you this first stage cancer, I'm going to do this and this to help you get healed, you'll get healed. Even if it's stage 4 cancer, it will get healed. Because there are some stage 4 cancer that are just localized. For example, if it's cancer of the uterus, it has moved to the fallopian tubes.
Yes.
If this doctor removes the fallopian tubes and the uterus, and we are sure this cancer has not moved to the lymph nodes and any other parts, then we do chemotherapy or radiotherapy after that, you get healed. Kenya has really advanced. There are several cancer centers, around 8 cancer centers, Nakuru, MTRH, KNH, we have Texas, we have so many. So if you reach these points early, these people will treat this cancer and will get well. Yeah.
All right, we are taking a short break here at Health Hygiene and Wellness. Don't go too far, we'll be back shortly.